Hi, good morning, everybody. I'm Jenna Morgan, fifth year EMIM, and I will be giving today's wellness topic, replacing scarcity in medical training. Special thank you to Dr. Ahmed, Dr. Dilip, Dr. Stetz, Dr. Willis, Dr. Wolfram, Dr. Berlin, and Dr. Chow for being in my corner on this topic and helping me navigate just creating a great presentation. So just to set the tone, for those of you who have read Stephen Covey, The 7 Habits of Highly Effective People, you'll recognize this photo or this picture. But depending on your perspective, you'll see a young woman, like with like a feather hat, or you'll see an old woman with a scarf. And so just take a minute to see if you can tease out the difference between the two images. And now that I've pointed it out to you, you can probably see both. And that's my goal for this lecture. I want to highlight something that affects each of us, whether or not we're really willing to talk about it. And hopefully after I talk about it, it's something that you can just sort of take home, stick in your back pocket, ruminate over it. You know, if you don't agree with it, that's okay. Don't come for me. But just, just, you know, think about it. It's a different perspective. And just some housekeeping. This lecture is for a room with people or Zoom. And so whatever, just to create a safe space and whatever is sort of said in this room, like some people, I'll ask for some sharing and some people may feel compelled or brave enough to share. And so whatever is said in this room or in the Zoom atmosphere, please let it stay in this space unless it's that I gave an awesome presentation and then let that be known to the world, okay? Do we feel like we can respect that? Okay, cool. All right, let's get started. Show of hands, and if you're on Zoom, please participate too. Okay, so who has ever thought to themselves, I am not a good resident? Yeah. Who has ever thought to themselves, person X is not a good doctor? No, okay. Who is a self-proclaimed perfectionist? Who has ever compared themselves to a colleague? Who is satisfied with the amount of work they do? They feel like, you know what, I do enough. I'm good. Great. Who has ever felt like, I don't know enough to be here? Who feels any sense of pressure or anxiety when you start a new rotation, or for attendings, if you start a new job, you're in a new location, etc.? Who has ever felt alone as a medical student, a resident, or an attending? And who has felt alone but pretend they never have felt alone? Okay. So thank you for raising your hand and participating. So just a quick overview of what I'll talk about. I'm going to talk about shame. And the overview is why shame, physician burnout, what is it, and how to navigate it. This is treatable. So for physician burnout, I know we talk about this all the time, but it's because it is a real issue. One article in JAMA said 1/3 of physicians at any point in time are experiencing burnout. So if you just sort of take a cut of the room or even take a third of who's on Zoom, that is the amount of us that are feeling burnout at any time. And the fact that so many people are feeling it shows that it's a systems issue and we're all affected. It's in the medical air. And what is it anyway? Burnout, by an article in Mayo Clinic Journal, it says it's exhaustion, cynicism, and reduced effectiveness. And it's hard to talk about because as doctors, we get a little squeamish. Like we can always tell everybody else like what they need to be doing about their lives. But when it comes to us and really assessing our own areas of growth, we don't like to talk about it, right? Our cultures, we emphasize that you have to be smart, you have to be put together, you have to be effective, you have to work hard. And that leaves little room for concepts like shame and pain. And just my soapbox moment, if you have ever had a rotation with me or done a shift with me, you know that I'm a little preachy, and my sister jokes that I have a soapbox in my back pocket. And so really, I just want to use this time to put words to what we're feeling as a whole, because there's a degree of emotional pain that comes with being doctors. And we're seeing that within ourselves. And hopefully, it's something that we can change. There was another article in JAMA that said 20.9 to 43.2% of residents, depending upon the analytical tool that they used, said that 23% of residents are experiencing depressive symptoms, and those symptoms increase with the calendar year. And so that really just emphasizes again that it's part of our culture. Just by being in this environment of medicine, that we're contributing to our own negative well-being. And so shame comes into all of that. And it's important to give it a name, right? Language matters. There's an abundance of discussion around fatigue, decreased productivity, but there's not a lot of language that uses the word shame. And when I say shame, I'm referring to the atmosphere that we create for ourselves and what we feel personally. And often when we speak of shame, right, we cite egregious examples of the surgeon throwing an instrument at someone, and then we look at each other like, thankfully that we're not in surgery. But really, it's all of the culture of medicine. And if we each sort of own it, acknowledge it, own it, and fix it, we can help change the culture. A lot of this talk is going to reference the work of Brittney Brown. If you're not familiar with Brittney Brown, her work is amazing. She has really pioneered the discussion around shame and brought it to pop culture. She's a qualitative researcher, and she collects data about shame and puts it up, makes it prevalent or makes it known in society and tells people how to cope with it. And she follows the model of Bell Hooks. So if you don't know Bell Hooks, she's like the feminist author. And she publishes academic work just in regular books and written in lay language to bring it to society and sort of to get it out of the hoarding of the academic circles. And so I say all this to say a lot of what I'm going to say right now is based off of data. It's not just sort of someone speaking about how they feel. And hopefully it can identify with you. So I'm going to talk about trends in shame-prone cultures. And just as I'm going through them, if you just sort of see if any of them resonate with you, if you've seen any of them within our culture of medicine. So shame-prone cultures have an emphasis on what people think. There's an encouragement of perfectionism. Numbing is common. So just, whatever you call numbing behaviors, there are a lot of them. Scarcity is the law. So intense competition, intense, not enough, I'm not good enough, I'm not smart enough, he's not fast enough, she's not, put together enough. They encourage certainty. So emphasis on being right rather than getting it right. And I'll talk about that a little more. Comparison is the norm. Exhaustion is a status symbol. High level of anxiety in general. Self-doubt is common. And emphasis on being totally in control. So what Brittney Brown does, she creates definitions that just help people identify difficult emotions and be able to put language to difficult emotions. So she defines shame as the intensely painful feeling or experience of believing we are flawed and therefore unworthy of love and belonging. And it's a powerful master emotion, and it's the fear ultimately that we're not good enough. And words matter. So by talking about love and connection, it feels really mushy and it almost can feel a little bit irrelevant, but it's really, right, it's what's beautiful about medicine, and it's why we got into medicine, and it's really the beauty of life. So like, who has ever felt a moment of connection with a patient? Or who has ever felt a moment where they had a great connection with a colleague? Like, isn't it awesome? And so that's what we really look for as human beings. And shame really takes away that feeling, and it takes away all of the goodness of what we're looking for in our experiences. So a few things about shame: we all have it. It's a universal primitive emotion. The only people who do not have shame are people who lack capacity for empathy, like sort of sociopaths. We're afraid to talk about it. It's a no-go topic. So I'll share something. I was telling someone very close to me that I was going to present this to my residency, and they're like, why would you talk about that? And the thing is, right, like, because if you talk about it, then people will know that you feel it. And that's the ultimate fear. But the thing is, we need to talk about it because silence amplifies it. And really, once you talk about it, once you shed light on the experience for yourself, or if you notice that you're creating that experience for others, it cuts it off and then creates the opportunity for change and something different. A few distinctions. So there's shame, guilt, embarrassment, and humiliation. So shame is the feeling that you're unworthy of love and belonging. Guilt is actually good. So shame, in the data, it showed it had negative correlation with behavior. So if someone was doing a behavior and they felt ashamed of it, it actually worsened that behavior. Guilt is different. Guilt is association with holding up an action against your values and focusing on the action. So it would be like shame is like, I am a bad person, versus guilt, which is I did a bad action. Guilt creates a space for growth. And embarrassment, it's a sense that like everyone is experiencing the same thing and it's nothing you really need to feel badly for. You don't feel like you're unworthy because of it. And humiliation, you have the sense that like if someone does something to you and you feel like you did not deserve that, that's humiliation. You're sort of pissed off at that person. Versus with shame, you'll actually feel like you deserve that treatment. Okay, how shame shows up. In cultures where very shame-prone cultures, there's fear of disconnection. And that fear of disconnection shows up as emphasis on fitting in, which means like you throw out parts of yourself to mesh with the group. There's emphasis on perfectionism, and I'll talk about it a little more, but perfectionism is the armor we put up on ourselves to prevent shame. And so it's a sense that like, if I do everything right, if I'm always put together, if I never mess up, then I won't ever feel ashamed. The problem with perfectionism is that it's not real. Perfection does not exist. Excellence exists, but perfection does not. And so ultimately, we're always going to fail at something and we're always going to have to try again. And perfectionism doesn't leave room for that. And judgment is really important. Judgment is what we do to others for our own shame triggers. And so in the data, she saw that we only judge other people for what we're ashamed of ourselves. So if we actually feel really confident and secure about something, we won't judge others for it. And I thought that was really interesting. And rejection of the ordinary. Right? This is the concept of scarcity and never enough. It's a concept that either you're a rock star or unworthy. And I think we see that a lot. Like we do that a lot in our own culture. So again, perfection versus excellence. So excellence is good. I know based off of what I'm saying, it may seem like I'm saying, like I'm encouraging complacency or absence of accountability. And I can see someone thinking that, but that's not true, right? Our career, we need grit, we need accountability, we need rigorous learning, we need rigorous training, and excellence leaves room for that. But shame doesn't. Excellence or perfectionism doesn't. Excellence has a concept of failure built in. I like to think of the example of an athlete, right? Sort of physicality doesn't lie. An athlete has to try again and again and again, and they might lose again and again before they start to win. Versus in academia, we really don't like to leave room for that as much. And like I said before, perfectionism, it doesn't leave room for that failure. And so what does it look like in doctors? One, we won't admit it. As doctors, we find it hard to either say that we're feeling this or to confide in other doctors. We don't hold boundaries. So even like regular basic things, right? Like who's ever held their urine for an extended time during a CCT shift, right? Or just like skipping meals during a shift, going home very late, 2 hours late for just like regular stuff. And that is how it is one of the common ways that it manifests on doctors, especially doctors in training. Second victim syndrome. So, we've talked about this before. It's a sense that, we're responsible for the outcome of our patients ultimately. And that is true to an extent, but to a large extent, it isn't true. So an example would be just like if, this happens to us a lot, like if someone with 5 comorbidities sort of at the end of their disease processes shows up before us and has a negative outcome, we feel like we're to blame if we forgot one medication versus that they had a whole life that was sort of leading up to this point. And second victim syndrome is sort of us blaming ourselves for each and everything that happens versus seeing the larger picture that, yes, you can have an area of growth, but also you're not in control of absolutely everything. And of course, burnout, which we've talked about before. So shame resilience. So I know this is all pretty heavy, but there are ways that we can heal and we can move forward. One of the first things you can do is recognize shame. So recognize when you're in the grips of it. Like, does your face feel hot? Are you crying? Figure out what your body is telling you when you're in shame and just acknowledge it so you can sort of check yourself and say, okay, this is what I'm feeling. And like I said, practice critical awareness. So if you're in shame, sort of take a step back and say, like, okay, what am I feeling? What is sort of the tape that's playing? And is it true? Is it attainable? And what can I do to fix it? And what can I do not to sort of perpetuate this feeling onto other people? And reach out. And so I know people say reach out a lot, right? And there will be like talks like go to therapy, which is important. It has a role. Also, you can reach out to people who have earned the right to hear your story. So people who you trust and also you can trust someone, but also they may not be equipped to hear it. So if you're in shame about something and then that person is also a shame trigger for them and you'll tell them, they'll be like, oh my God, how did you do that? How could you? That will exacerbate your shame. But if someone has who's done a lot of self-work or they have a lot of strength and they can hear your story and let you know, like, it's okay, they can hold you accountable, but still be honest and still let you know that you are worthy. That is a person to share your story with. And speak shame, say the word. So words really matter. They convey exactly what we're feeling. And you can say to that person, I feel ashamed because X. And foster empathy. So empathy is the remedy to shame. It is, and a lot of times we get confused about what empathy is. Empathy is not necessarily having experienced the same thing as someone else, but it's connecting to the emotion that they're feeling at the moment. And once you practice empathy or experience empathy for yourself or others, you can really stop sort of the shame spiral. Okay, and she has some 10 guideposts to wholehearted living. The first, and I'll just go through them quickly. The first is to be authentic. She has a saying where she says, show up and be seen, where basically it's just let others see you for who you are, just as you are, flaws and triumphs, and it's okay. Practice self-compassion and let go of perfectionism. Cultivate excellence. Cultivate resilience and let go of numbing. So instead of, trying to run away from painful experiences or painful feelings, just feel them and sort of work through them instead of cutting them off. Because when you cut off pain, you also cut off joy. And so she encourages letting go of numbing. Cultivating gratitude. So letting go of scarcity, letting go of the feeling of not enough, and just acknowledging what you have and seeing that by acknowledging what you have, how it can become more and how you can really enhance upon that. So fostering trust and faith. So encouraging the concept of getting it right over the emphasis of being it right. And, if you take time to think about the difference between those two things, getting it right versus being right, getting it right has a level of humility already built in. versus being right has a level of arrogance already built in. And if we have the culture of getting it right, we can go so much farther than just saying, okay, I'm right, I'm right, I'm right, I'm right. Cultivating creativity and letting go of comparison and just trusting where you are on your journey, trusting where other people are on their journey. Like, not everyone has to be at the same place at the same time. We're all different people with different experiences, and acknowledging the beauty that comes with that. Cultivating rest and play. So letting go of productivity as a status symbol, and letting go of exhaustion as a status symbol. Often, we're just like so proud that we're so tired. And it's not a good thing, right? You should sleep, you should work hard, but you should sleep. And both are equally important. Cultivating calm and stillness, letting go of anxiety. I think that just speaks for itself. And cultivating meaningful work. I think instead of sort of, as you're working, looking for the approval of others, searching for that perpetual gold star that we've been trained to get since kindergarten, I think looking for the ultimate meaning in your work and letting that be a reward for itself. And joy, cultivating laughter and song and letting go of always being in control. So those 10 things were things that she saw people who were wholehearted, who were shame resilient doing, and she offered them as solutions to us in general society. And that's it for me. Any questions? I know that was pretty, is pretty heavy in some ways. Any questions? Yeah, Emily.
I would just add in that not only is it important to rest and take care of yourself, but also for your teammates. I think we often feel like if we're working nonstop, we're benefiting everyone. But really, when you come on to shift and you're tired and you're cranky and you're hungry, not only does it not provide good patient care, but it's really not good for the rest of the team. And honestly, it would be better almost to not have someone like that there than someone who comes in and really kind of not taking care of themselves. So I really think you have to remember you're benefiting your patients and your colleagues as well as yourself when you take care of yourself.
Absolutely. Dr. Willis?
First of all, I just want to say thank you for presenting this. I think it's a really tough thing to talk about.
Thank you.
It's important to talk about. The thing that really kind of struck me is perfectionism. I think it's something we kind of like think that we're going for, but I feel like a lot of times it's the antithesis of something we want to do. Because if you feel like you're perfect, I think it's a really dangerous thing in medicine.
Yeah.
Then you're apt to make more mistakes and not be willing to kind of hear new data and new
Absolutely.
perspectives and what's going on. I think especially in emergency medicine where we've got such little amounts of data to kind of think that we have the right answers all the time.
Absolutely.
And I think shame, I think it's incredibly important. I think we all feel it. We all go through it. Somewhat, I think if you have shame, you're going through it. I think it means that you're not burned out. And I think maybe that's putting a little bit of a positive spin on it because I think it's part of what we do and what we experience every day. I think sometimes shame is going to be there. Whether we don't feel like we did the right thing that day, or we missed the kind of cue, or a lot of times I feel like for me it's about feeling shameful, like maybe not doing the right thing to a run, and not feeling like I did the right thing in the process. But I also think if you're feeling that emotion, that means you're doing okay in terms of not being burnt out. Because I feel like burnout is a defense mechanism. Because burnout is when you don't care, and you don't feel emotionally connected to the people you're working with, the people you're taking care of. So I think if you're not having a little guilt, a little these things, I think you need to talk about them. But I think it also means that you're connected to the people that choose.
Thank you for that.
Also, just one perspective, I've found in my practice that I think it's better if you can talk about your shame with somebody who's in the field, and I think it helps. But sometimes it's easier to talk about it with someone not in medicine. Somebody maybe who knows you from not being a doctor, because I think inherently they're going to know you as a good person, and you can kind of feel a little more protected and talk to them about those things. Because sometimes, like you said, you talk about it's going to be a shame trigger for another healthcare worker as well, and then be like, oh my God, how did that happen? but maybe somebody who doesn't understand kind of the medicine behind it will know that you're a good person, and that obviously you didn't mean wrong by it. Sometimes that can be easier. I found that most.
Thank you. Dr. Silverberg?
I think that's really true, and I think that the standards that physicians set for themselves in the community is sometimes unachievable.
Mhm.
And having a significant other outside of medicine, when we talk about she's like, how is that even possible? Like, why would you even shoot for that? That's ridiculous.
Mhm.
It's not humanly possible. I think having a significant other outside medicine is incredibly revealing to how foolish we are in the standards that we set, that sometimes are not even achievable.
Yeah. Okay.
It doesn't, and I think that's true. It doesn't have to be significant other, as everyone knows.
Yeah, it can be.
A physician wife, so.
It can be anybody, across anybody, even
It
for
works.
parts.
Yeah.
The other thing I'll say, sorry, Jenna,
No.
it's just like if you are feeling like you have nothing left in you, that is also okay. If you think about the things that we make ourselves do, we make ourselves care about these people that we have only met for 5 minutes, like multiple times a day, who have usually sad stories. And sometimes you just like have to remove yourself a little bit to take care of yourself, and that's totally okay. It's sad, but it's fine. You are one human being and you're doing so much.
It's incredibly draining.
Yeah.
Absolutely. Okay. Thank you for sharing. Take care.